I'm here with a topic that all you need to know on therapeutic positions from Nclex point of view. So let's begin. So therapeutic positioning, it's placing the person in proper alignment for preventive, for promotive, curative or rehabilitative process, or for a diagnostic procedure, or for a therapeutic intervention, or to prevent some damage, right? So what are the common therapeutic positions that we come across? First, supine position. Second, lithotomy position. Third, prone position, lateral or side lying, Sims position, Nietzsche's position, Trendelenburg position, or Fowler's position. Let's discuss each one briefly that you need to know for Nclex point of view. Now, supine position. Supine position means in this the person lies straight, which means head pointing upwards, and yes, this may be having with a pillow under the head. So this is used for GI assessment or while a person is resting. So this position is also maintained after a person has had a procedure called as spinal tap, in which they take some of the CSF for the testing, that is for microscopy or cytology. But yes, you need to tell the person to lie in supine position after spinal tap, but without a pillow, right? So you have to keep this thing in your mind. Now second position is lithotomy position. So the lithotomy position, in this position what happens, the female lies on the table, and yes, her feet, basically her legs, they rest on special appendages on the bed. So this is lithotomy position. The other lithotomy position can be in which these feet that I've highlighted, they rest on the edges of this bed, right? So these are two forms of lithotomy position. It's used for childbirth, used for pelvic floor repair. This happens in such cases in which there is traumatic birth, or in which we can say there is perineal tear due to birth, or also in males also, and also in females when they are undergoing hemorrhoidectomy because they want the rectum to be visualized. Now the next position is left lateral position. So left lateral position means lying down with on the left side. So this usage is while administering enema, while inserting suppository, for digital rectal examination, which is a screening test for benign prostate hyperplasia, and also for taking rectal temperatures. Now, Sims position, it's used as a comfortable position in the persons who are long-term bedridden patients or critical ill patients or neurology patients, which are long-term patients, right? So what happens in this scenario, just see, these arms rest on pillow, right? Legs are resting on the pillow, head. So pressure is relieved of the scapula, pressure is relieved of these bones, right? Pressure is relieved of these sides. So this ultimately means that this is helpful in preventing the occurrence of what? Occurrence of decubitus ulcers or pressure ulcers. Now, what is next? Next is knee chest position, right? So for knee chest position, when is it preferred? It's preferred when the endoscopy for lower GIT is being done, like in sigmoidoscopy, in proctoscopy, or when a gynecologist has to look into female's vulva, so vulvar examination, or when there is cord prolapse in labor, you need to have the patient in this position, right? So next position is Trendelenburg position. Trendelenburg position means head on the head lowered and foot end raised, which means foot end are raised more than the head. So this is preferred in hypotension if person has low BP, means systolic blood pressure less than 90 millimeter of mercury, or when central line is being inserted, or when there is removal of central line or removal of femoral sheath, or in cord prolapse. So in cord prolapse, if you would have noticed that we give both positions, we can prefer knee chest also, we can prefer the Trendelenburg position also, right? Now let's come with this Fowler's position. So Fowler's position means they have three variations. Like high Fowler's means head end raised from 75 to 90 degree. Semi Fowler's means head end raised from 40 to 45 degrees. Low Fowler's means head end raised to 30 degrees. Now let us discuss some important therapeutic positionings that you should know for any of your entrances, right? So this is going to be a very short video. Please view this till the end to get more benefit from it. So there are some important therapeutic positionings. So in therapeutic positionings, if woman is in labor with non-reassuring heart rate, suppose the heart rate, fetal heart rate, you know that it is normal if it is beyond 110 to 160 beats per minute. So if it's going low or there are decelerations, ask the person to bear the position that is left lateral position, right? If you post tube feeding, if you have given NG tube feeding, so you do not want this gastric content to hurry up, right? Or to be going into the intestine very fast or to regurgitate, right? Basically it's to prevent regurgitation. We keep the head end of the bed elevated. Now after cataract surgery means in this there is emulsification of this lens that is originally present and you replace the intraocular lens, right? In after cataract surgery, you ask the person to sleep on the unaffected side. Suppose the person has had cataract surgery for his left side, ask the person to um, take the right lateral position while sleeping, and he or she should wear the eye shield. Now, post-thyroidectomy, the position to be maintained is low or semi-Fowler's position. In autonomic dysreflexia is a term that is used majoritically in the psychiatric conditions when we refer it to as the increased pressure buildup due to fecal matter or due to urine, right? So this ultimately shows up the signs of increased blood pressure, excessive perspiration, racing heart rate. So in such conditions, you have to give this person high Fowler's position. After liver biopsy, you have to ask the person to lie on the right side for at least 2 hours because liver is very vascular organ, and yes, to splint it externally, we need the person to have this position. Now, if person is having shortness of breath, everyone answers it's to be Fowler's, semi-Fowler's position, but the best answer is high Fowler's. The second best is Fowler's position. Now, there is a condition called as dumping syndrome. So what is dumping syndrome? Dumping syndrome means the stomach gets emptied very fast. So in such positions, you'll ask the person to eat in low Fowler's position or to immediately lie down after meals for at least 20 to 30 minutes, which means at least the stomach will get 20 to 30 minutes for food to store in, and yes, there will be ultimate digestion of certain carbohydrates which gets done in the stomach. Now after lumbar puncture, you need to have the person in supine position during thoracocentesis, which means the removal of fluid from your lungs in cases of pleural effusion, which means between the visceral and parietal layers, between visceral and parietal layers of the lungs there is fluid accumulation. So under ultrasound guidance there is removal of these fluid. So this is called as pleural effusion. The position maintained is orthopnic positions with shoulders wide apart and with arms resting on the cardiac table. This is pleural effusion, right? Thoracocentesis basically. The most important and most tested and most confusing part is position in patient post air emboli with difficulty breathing. So yes, almost everyone will answer it to be high Fowler's, but yes, my dear friends, So this is not a high Fowler's position. This is the position we give is left lateral Trendelenburg position or Durant's maneuver. So do you still have this thing in mind that why is it so? Why left lateral and that too Trendelenburg? So let's just have a look on this diagram, right? So just like have a look on this diagram. So this figure at the bottom, this shows that there is bubble, right? There is bubble. So these are basically openings. This is the bubble. So in supine position, it can go to the pulmonary artery, to the lungs, and it can cause ultimately distress. So now what you need to do, you will place this person in left lateral position. In left lateral position, what happens? This bubble is displaced, right? It goes into right atrium. So from right atrium, it gets blocked here. So ultimately the damage would be lessened, and then you just inform the primary care health provider that yes, air emboli has occurred. So this is all you needed to know about therapeutic positioning from NCLEX or from competitive point of view. To know more about such things or to have such interesting topics, to enroll in our 12 weeks nursing comprehensive course which will make you NCLEX ready. Thank you for watching this video out. If you like this video, kindly share it with your friends, and yes, do like this video and subscribe my channel. Thank you once again.